Hello and welcome to our webinar today on how to turn online patient feedback into actionable insights. My name is Melanie Fielder. I'm a Senior Marketing Programs Manager here at Reputation, and I will be your host today. I'd like to introduce you to your presenters, Celine Patterson and Clarissa DiCarlo. Celine is Reputation's Healthcare Strategy and Consulting Manager, and Clarissa is a Customer Success Manager here at Reputation. If you've turned into our previous webinars, you'll know that these two have deep roots in the industry and are actually both former clients of Reputation. Both have launched and led online reputation programs at their respective previous organizations. They understand the challenges of healthcare and are here to guide you on turning feedback into action. So today's format is going to be a little different. Please ask questions throughout and we'll be answering them in live time. Celine, I'll let you take it from here.
Awesome. Thanks, Melanie. So we're seeing that today's marketing and patient experience teams are working more closely to not only promote the brand, but also ensure the experience is delivering on that brand promise. And that's because consumerism has transformed the way we think about the healthcare experience, right? Meeting the needs of today's consumers requires collaboration across functions in order to deliver a more personalized, consumer-driven experience for patients. So today we're going to touch on two components: managing the brand and its sentiment, as well as improving the patient journey and quality of care.
Yeah, you're exactly right, Celine. Healthcare's changing rapidly and consumer focus has become a priority for most healthcare organizations. In fact, a recent survey of healthcare execs found that 81% have identified improving consumer experience as a high priority for their organization. However, only 11% of healthcare executives feel that their organization has the capabilities to deliver on a positive consumer experience. So we can clearly see there's a gap there. Help gathering and analyzing feedback, identifying trends, creating workflows, implementing organizational changes to improve consumer experience is a real need for healthcare organizations. So before we jump in, it's important to kind of level set on a few considerations and best practices that healthcare organizations should keep in mind when analyzing online feedback, specifically how often, what to look at, and who to involve. So for example, on a daily basis, it's important to monitor incoming feedback in real time using workflows like we've discussed in the previous webinars. This feedback should be routed to local teams who can provide service recovery, such as patient experience, risk, practice managers. A good example of that is, let's say a review comes in that a patient complains because they were 15 minutes late to their appointment because the address on the clinic's business listing was wrong. That's an easy fix. If the marketing team is set up to receive this instant notification of the negative reviews, they can jump quickly into the Reputation platform, fix the listing, respond to the patient, all in a matter of minutes. On a monthly or quarterly basis, we can begin to analyze trend lines in order to identify areas of improvement. And we can start to include more leadership teams on these reports, such as operational and clinical leaderships, teams who can really help drive the change that we're seeing based on those trends that are identified. And on an annual basis, we want to view this data holistically to track year-over-year growth across various service lines or providers. You really want to look at the data long-term too to see if all of those changes that you're making to improve the experience are in fact having a positive impact on your sentiment. And these are reports that you'll want to include more for executive leadership teams, such as your CEOs or chief medical officers, so on and so forth. So I think, it's important to keep in mind when looking at this slide too, that it's definitely not a one size fits all, because it really is going to depend on your organizations. I know we have clients or prospective clients watching the webinar today who might be from very small health systems, not have those huge corporate levels, and much, much larger systems that have, multiple layers. And so just keep in mind when looking at this slide, it'll change and vary depending on your organization.
Really good call out, Clarissa. So when we talk about where to start, what areas can immediately benefit from analyzing this online feedback, we kind of started comparing our previous experiences on the provider side. And we both viewed online feedback from three different angles. First, and arguably the most important, is through the operational and patient experience lens, the feedback that improves the consumer journey, but also through the marketing communications lens, the feedback that supports and helps guide marketing efforts, as well as the public relations lens, the feedback that allows organizations to be more proactive. So operational feedback, it's the feedback that works to enhance that consumer journey, that patient experience. And we really like to bucket that into two categories, short-term versus long-term. So short-term being the low-hanging fruit items that you can action on quickly in real time by local teams. So I once worked with a CEO who was very upset over one-star ratings his hospital was receiving about the ER bathrooms. And when I asked him if they were dirty, his response was, yes, they are. Okay, simple fix, go clean the bathroom. So not only did his team go clean the bathroom at that specific moment, they also made sure that it was done more frequently moving forward. And from that day on, shocker, the complaints ceased. So often healthcare systems receive this feedback that's non-clinical in nature, right? Such as concierge friendliness or a meal didn't arrive. Clarissa, you shared with me a really good example the other day about door handles. Can you share that real quick?
Yeah. So we're in Arizona, and in the summertime, it gets insanely hot, like 117 degrees hot. And so, when you have those metal door handles on doors into clinics and stuff, those can get really, really, really hot. And so I remember, once getting a patient review that came in that complained because they went to go touch the door handle and it was so hot, the sun was directly on the door at that time of day, middle of day, 170 degrees. They burn their hands on the door handles. And so that feedback comes in, and it's just an easy fix. It's an easy fix to implement at that clinic. You can just wrap a cloth or wrap that handle so that it's not hot during the summertime, especially during midday, so that doesn't happen to other patients. And also to implement across some of the other clinics so that you can prevent that from happening in the future. And so these are just those small, quick examples that we can almost instantaneously fix.
I love that example. And the point is that the feedback, is something that we can fix almost instantaneously. But on the flip side, there's going to be some more long-term based feedback, categories that require significant volume in order to implement some of this organizational change that we often talk about. And we saw this heavily during COVID-19 testing, vaccine scheduling. Over time, that feedback indicated what was going well and where improvements could be made. One really big area that I worked heavily on in a previous role was ER wait time. We had a few facilities where this was a constant issue before COVID and dramatically impacted the reputation and market. So at one location in particular, we were able to determine the main issue was actually just a lack of signage and lack of communication. So we placed monitors throughout the waiting areas that updated patients and their loved ones on the status in really compliant ways, as well as planted non-clinical rounding managers who would simply, just check in on patients and loved ones in a waiting area. So these were two fixes that required a lot of data to support that need. But once they were implemented, we saw a huge improvement in that ER wait time sentiment. But before we jump ahead into some of these more long-term examples in more detail, Clarissa, you had an awesome example of providing immediate service recovery that turned a negative experience into a really positive outcome.
Yeah, I really always love this example right here because it shows kind of how a patient comes, full circle after having a negative experience. So this particular patient, they were trying to get a prescription filled, something that should be so easy. And they were just coming into barriers after barriers, and they were incredibly frustrated. And they specifically said in the review, they will look for a new cardiologist. Now, yikes, like that's the worst outcome, right? Is that they are going to go to a competitor and you're going to lose their business over something that is so simple as a prescription refill that they couldn't get filled. And so this review came through immediately. Practice manager at the clinics notified. The platform sends out immediate notification to let them know they have a negative review. And in this particular instance, it was difficult to identify who the patient was off of their Google name. And so a simple response, thank you for sharing your feedback. We apologize. We want to get this problem solved for you ASAP. This review's been shared with our leadership. If you would be willing, please reach out directly so we can get this resolved for you. So that patient did. They picked up the phone, they called the number that was left on the response. And of course, the practice manager was amazing. As indicated on here, she was great. She made me change my mind. She was a real and treats you like you matter. They're lucky to have her. So the practice manager did a great job with service recovery. And then they say, I'm canceling my other appointment, the appointment I made to see the other cardiologist. And on top of that, this one is so great that the patient went back to that negative review and changed it to a 4-star review from a 1-star review. So, a small problem like getting a prescription filled was solved, but this particular client almost lost a patient over that. And so we were able to, keep this patient seeing this particular cardiologist and resolve this issue. Now, this particular one is great to showcase short-term, but also long-term, because the issues that were arising because of the prescription refill were phone issues. And so they had to do a deep dive into the phone systems and the phone issues that they were having, and implement some long-term fixes to fix that problem. So this one is a great way to identify both short-term and long-term. But Celine is going to jump into some more long-term examples for you guys today.
Yeah, so from a long-term perspective, right, this is the goal, is we want to be able to action on those really quick pieces of feedback like Clarissa spoke about, but also start to analyze some larger trends and see, are there common themes? Are there commonalities? Are certain trend lines going up or down? So in this particular example, our client used Reputation's AI and NLP to track trends over time. So in early 2019, they started to see that sentiment regarding their staff, nursing, and ER was steadily declining. And in early May of 2019, the online reputation management team there met with the local patient experience and leadership teams. And there they learned that there was recent high turnover, and this was leading to low staff morale and inconsistent shifts. So it was evident that these sentiments within staff were trickling over into the patient experience. So leadership began aggressively recruiting for open positions. They rounded more on employees. They created improved communication methods with their staff. They offered various feedback sources and surveys, and enhanced their internal work perks. So by July, sentiment started to improve in these areas. And by the end of the year, the 6-month comparison of before on the left-hand side and after on the right-hand side completely shifted. And this concept of employee burnout was clearly an issue before the pandemic, as evident on the screen, but has heightened even more so in the past 18 months and is something that we're actively working with clients to address on a daily basis. So this is an example of working with caregivers through category analysis, right? But Clarissa, you had a great example of how we can use these insights to identify areas of improvement for specific providers.
Yeah, healthcare is unique in that we manage the online reputation of the physical locations, such as clinics and hospitals, but we also gather feedback on actual humans working in those hospitals and clinics, our providers. So, for example, when analyzing data, you'll want to look for trends on specific categories like what Celine talked about, wait time, cleanliness, COVID-19. But you also want to make sure to see if there are any trends arising for specific providers. Perhaps a location is seeing a lot of negative feedback. And when you really drill down into that, you can see that the patients are not unhappy with the staff or the wait time or the scheduling. The majority of the feedback is on one single provider. And so the above, what you see on the screen, is something that an organization that we work with experienced. This particular provider was seeing consistent negative reviews on bedside manner, and it was driving down sentiment for the whole location. So they implemented some coaching strategies and for the particular provider, and you can see that sentiment continued to start to improve. And so it's important to look at both categories and facilities, but also to drill down to see if some of that sentiment is resulting from specific bedside manner or care on a specific provider, and then implement some strategies to improve that as well, as you can see on the screen here. So a lot of these examples here are really operational and patient experience, so on and so forth. But Celine's going to jump into how we can use all of this data to improve brand sentiment or to analyze our competitors. So, as we mentioned earlier, enhancing the consumer experience is one way as an RXM team may use online feedback. Another way many of our clients are using these insights is to help guide marketing efforts through two ways: brand sentiment analysis and competitive analysis. For example, are you about to rebrand or launch a service line marketing campaign? Before doing so, it's valuable to know what people are already saying about you and that service. Is it favorable? Then it may be worth rethinking the campaign before throwing a bunch of money at it. If so, you could leverage positive testimonials if it's favorable and use positive themes you see throughout. And to do so, the same with your competitors. Maybe you want to see your competitors, how they're delivering on their mission or even your mission. Use these insights to call out differentiators. So we're going to go over some ways our current clients are using online feedback to fuel marketing campaigns.
Thanks, Clarissa. So first, and probably one of my favorites, is through Testimonial Reads. So one of our clients implemented a 5-star moments video campaign that you see on the screen, featuring caregivers reading positive online reviews out loud for the first time. And I really love this because it captures the raw emotion of the caregivers in real time, something that not only promotes the service lines that they provide, but is also a wonderful recruiting tool. And we'll be sure to put the link in the chat so that you can check it out in your own time. But second, through traditional media. Many of our clients will highlight high star averages on billboards, TV ads, print materials, etc., you name it. And third, a very popular way to improve SEO is to showcase these third-party reviews via a widget on your own website, something we do with many of our healthcare clients on a daily basis. Now, as mentioned, it's important to know how you're faring amongst your patients, but it's just as crucial to know how you are faring compared to your competitors.
Yeah, competitor insights can allow you to gather even further feedback. So our competitive insights tool can give you that same online feedback you gather for your organization, for your competitors, and you can analyze it in the exact same way. So you can see the two screenshots above of what it would look like for your brand, and then being able to pull in the exact same data for a competitor brand. And this can help to reinforce organizational changes that might need to be made. So, for example, pricing is something that comes to mind. If patients are continuously complaining about your imaging prices for one of your imaging locations for your clinic, you can look at and analyze that data on your location, but you can also look at your competitors to see if pricing is a pain point for their patients as well. And if it's not, then this is a great opportunity for the organization to analyze that all together and start to have conversations on how to combat this. And so there's lots of different areas, and Celine's going to continue to drive on this, where we can take this data and look at it on how we can improve in different areas of the organization.
Yeah, so lastly, wanted to dive into public relations and brand management just a little bit. The feedback that allows organizations to be more proactive and less reactive. And that was one of my biggest challenges on the provider side. So in order to do so effectively, it's really, really important to know what's being said about your brand across all channels, right? Whether that be reviews, social media, blog articles, news stories, etc., in real time, and have a plan on how to react to various scenarios, whether they are positive or negative. So a few positive examples may be, let's say, events such as groundbreakings, acquisitions, or new technology. Maybe it's the work that you're doing with influencers in your area, such as awareness campaigns during observances like Breast Cancer Awareness Month this month, or overall positive news stories, such as the ones that we've seen a lot of during the pandemic with our healthcare heroes. And unfortunately, there's always going to be the opportunity for less favorable coverage, right? The ones that might go viral, such as negative employee behavior or unfortunate cases that gain publicity. And maybe that's keeping a pulse on COVID-19, how it was handled in your county, your state, nationally, globally, and wanting to keep track of what's being said about COVID-19 in relation to your brand specifically as well. And this is where combining the insights of reviews with the insights of social listening are incredibly valuable to proactively track what's being said, when it's being said, and where it's being said. I know that what we have on the screen is a lot to look at, but it's just a very small sneak peek of how we track sentiment of all online chatter, the viral potential, the emotion behind it, and more. So stay tuned, because our next webinar in early 2022 is going to specifically speak to social listening in the healthcare space. So before I let Melanie wrap us up and we go into Q&A, since this is our last installment of this particular 3-part mini webinar series, Clarissa and I just wanted to wholeheartedly thank everyone who has joined both today and throughout all of the sessions. We've truly enjoyed sharing this information with all of you and hope that you have found it to be valuable. And just know that our healthcare team looks forward to sharing more with you in future Reputation webinars. So I'm going to kick it over to you, Melanie.
Thanks, Celine. And thank you, Celine and Clarissa. Great job, you guys. As a reminder, everyone, this recorded webinar will be available if you'd like to revisit it or share with anyone else. In case you missed the first 2 installments of this mini series, you can revisit them at any time. I will drop the URLs in the chat in a moment. But we'll go ahead and jump on over to Q&A. So first one. What is your recommendation for who should analyze online feedback?
Yeah, I think we can both answer this, right, Clarissa? Because I know in our previous organizations and what we've seen with clients that we work with now, that's going to vary depending on the size of your organization, your bandwidth, et cetera. So previously, I built and led an online reputation management team. So we did a lot of this in-house at a corporate office for all of our facilities, physicians, et cetera, our hospitals, and mental health services. So we had somebody that was analyzing all of that feedback, tracking all of those trend lines, and then working very closely in collaboration with the local patient experience teams, the marketing teams, the quality, risk, et cetera. So it really is a collaborative effort, but making sure that you have dedicated individuals can definitely help. But I know that that might not always be the case with limited resources. So Clarissa, I know you had a very different
we were a much smaller organization and with a lot less dedicated resources to our online reputation. And so, but it kind of worked in the same way, you know. Marketing and my role really was the role that kind of put all of the data together. You know, and we use the reputation platform to help us do that. So we were really the ones kind of analyzing the data to see if there was trends. And then if there was anything that we noted, that's when we kind of kicked it off to patient experience. Now we had lots of regular reports set up and, you know, scheduled reports that were going out to leadership and practice managers, patient experience, so on and so forth. So they were viewing that data on a regular basis, but really for us, it was the marketing team that was kind of, because we owned the reputation initiative, kind of taking the lead on looking at all of the data. But as soon as anything was identified in terms of trends, that was then kicked off, you know, to our patient experience team and our operational leaders to further analyze and have discussions about what change needs to happen within the organization to fix that.
Wonderful.
Great question.
Next one for you. What is the best way to report on online feedback?
Oh boy. So I'm going to actually jump back to the slide that Clarissa talked about earlier. Is there's going to be a bunch of different ways, right? You can do so monthly, quarterly, annually. I know that the more data that you have, the more statistically significant it is, right? So your daily feedback is really going to give you on pulse on what people are saying in real time. But in order to really analyze those trend lines, we recommend looking at that maybe monthly or quarterly, again, depending on that review volume that you're receiving. The best way to report on that really depends on how your leadership wants to digest that information, right? I know it can be cumbersome when we're throwing all of these different types of reports at them. So you want to make sure that it's meaningful for them, it's easy to read, and that it's aesthetically pleasing. We offer different modules within our reports at Reputation that are customizable depending on what they want to see. Is that, your vanity numbers, such as your positive percentage increases, your number of volumes, or where those reviews are coming from, et cetera. Whereas other people might be more interested in word clouds or really taking a deep dive into those service lines and those trends by category, right? So there's all different kinds of way to report on that, depending on how your leadership team wants to look at that. But Carissa, I know you did some reporting too in your previous roles, and just what you do on a day-to-day basis with your clients. Do you want to elaborate?
Well, yeah, but I really want to touch on one thing that you said just recently was the more feedback, the better. And so that couldn't be more true. I mean, the more feedback we're getting that we have to analyze, the easier it's going to be to really identify some trends. That's why, we're such big proponents of review requesting, right? It helps in a lot of different areas, but it also helps in gathering more feedback that we can analyze to look for trends from a patient experience perspective. And then we also have a lot of clients that are ingesting other survey data into our platform, whether that be their CAPS data or any other, surveys they're doing within their organization. And they're using all of that data coupled with all of their online review data and getting a really good, solid, full picture of, what's happening within their organization. And then it makes it easier to see trends, or you can start to see those trends quicker than if you were just kind of analyzing one set of data. So I think that's really important note to make, is the more feedback we can get and the more feedback we get to analyze, the quicker it's going to be to identify some of those trends that we're going to need to make some organizational change on.
Wonderful. Thank you. How do you know when the data is significant enough to warrant serious action? Large versus small hospitals, as an example.
That's a really good question. So I always say that each review should be treated as importantly as the one that follows it or the one that comes before it. Mm-hmm. So it really depends, right, on the context of the review. So if it's something that's a pretty big complaint, obviously, you really want to take action on that in a very serious manner. If it's something like Clarissa's door handle example, that's something that's easy to fix. In terms of, statistically significant enough for it to warrant organizational change, such as, the COVID-19 example and the ER wait time, it really, again, depends on your organization and where you're seeing that align with maybe other sources of feedback, right? Are you seeing that be in conjunction with some of your CAPS data? Are you seeing other surveys say the same type of information? Are you doing connect calls after a patient is discharged? So see where those trend lines align. But I always say that no complaint is really too small for it to warrant action. I don't know, Clarissa, what would you say to that?
Yeah, no, I completely agree. I mean, I think that you're going to want to take action on those little ones, but you're also going to want to watch closely to see if you get any more feedback that is similar and aligning, and then compiling that all together. And then, like Celine said, it really just depends organizationally where you can focus your priorities and really, implement change at that particular time. So yeah, I agree with what Celine said there for sure.
All right, we are approaching time. So we have one last question that we can squeeze in. What are the best metrics to pay attention to when determining if any operational changes are making an impact on online reputation?
Ooh, also a good question. So there's
many good questions. There's so many good ones.
I know. This is a good one. So there's going to be a lot of different metrics. We really want to make sure that we're looking at our negative compared to our positive sentiment percentage as a whole for all of your online aggregated ratings, but then we want to make sure that we're also looking at depending on your service line. So let's say, you're working very hard to change, let's go back to ER wait time, right? And we look at that sentiment by category. So we can look at that trend line over time, see specifically where we were starting to implement some of those internal changes, whether it be those monitors or those non-clinical rounding staff. and make sure that we benchmark that time and see where the trend line goes from that implementation. Is it starting to go back up? Is positive sentiment and review volume in a positive way starting to go up or down based off of that implementation date? So that's a really good metric to look at so you can really hone in on specific initiatives that you're making operationally. But then, of course, you know, depending on other initiatives, right, such as just overall online reputation and improving your star ratings, getting more volume of reviews, you know, review requesting comes into play, which I know we talked a lot about in our second series of this webinar. But Clarissa, do you want to add anything to that?
Yeah, I think, you know, when our platform takes all of those reviews and organizes them into different categories, and I think when you're looking at the metrics for those particular categories, inside your organization, some of those categories are going to be metrics that are going to be a high priority for one department, and others are going to be a high priority for another department. So in terms of appointment scheduling, you know, that's a really good one category that we have, that it's really important to look at that trend line, but that might not be so important to, you know, the marketing team as it is to your patient access team. They're going to be the team that really is going to want to put a lot of focus on that particular metrics, those trend lines, and if you're driving change in that particular area, and how you stand up against your competitors and what reviews are coming in. So I think you know, Celine and I talk a lot about having the entire organization really embracing your you know, reputation experience management initiative. And that is because different metrics matter different to different, you know, departments and organizations within your organization. And so just looking at it in terms of, you know, which metrics matter to which area, I think is important as well.
Well, that concludes our presentation today. Again, thank you, Celine and Clarissa. You guys did an amazing job. Everyone who attended, thank you for being part of this. I would like to remind you to keep an eye out for our webinars coming up in early 2022. Have a wonderful rest of your day.
Thank you.
Thank you all.